Well, welcome to the School Health Advisory Council Town Hall. I'm Michelle Smith. I'm the state coordinator for Action for Healthy Kids. And this is actually our second town hall. We had one in the summer of 2020 when the pandemic had just gotten started, and SHACs were kind of struggling with what their role was. So we had a town hall and brought together some of our SHACs to share what they were doing and how things were going, and kind of give some thought to how we could better support our SHACs. We have done webinars. We've put together some resources and different things. We know that, parents, students, and SHACs are struggling with a lot of issues. We have some resource pieces we hope to introduce in the next month. And then also we're trying to put together a little micro website where we can post more information. So this last summer, we started a network. We're trying to get people who are on SHACs or want to be involved with SHACs to join a network where we have an easier way of communicating. Action for Healthy Kids has a newsletter we send out monthly, but this is something that's just dedicated to things for school health advisory councils. So hopefully we have like about 170 people that have joined the network. We want to grow that number exponentially, and then hope that we can engage people in the next legislative session, so that we have good policies passed around the work that SHACs do. So for today, I'm excited to turn the facilitation of this event over to our colleague and greatly respected Regional Dean of UT Health, School of Public Health in Austin, and the founding director of the Michael and Susan Dell Center for Healthy Living, Dr. Deanna Hoelscher. She is very well known for her SPAN research. That is school physical activity and nutrition research for schools. And we rely on that information to help guide us in a lot of the work we do. She's going to introduce our panel and our regional leaders who will share their perspectives on SHACs and how we can best move forward. So Deanna.
Thanks a lot, Michelle, for that nice introduction. And thanks to all of you for being on this morning. So we're gonna start out, as y'all all know, school health can really influence child health and family health. So it's very important to be able to set the school environment, school policies at the local level. So you all play a very important part in that. And now I'm excited to introduce our panel members. So as I introduce each of you, if you could just give a little bit more about your role as it relates to SHACs, and then I'll go on to the next one. So the first panel member is Karen Burnell, who's Texas PTA Healthy Lifestyles Chair, and she's a parent on the Richardson ISD SHAC. Karen?
Thank you, Deanna. Yes, so my current role with Richardson's SHAC is I am their chair this year, rolling into the primary chair, and we are currently working on revisiting our bylaws to just have more continuity with establishing a vice chair and having those leadership roles to create that continuity with the district work and revisiting our procedures. And so I've been on the SHAC since pre-COVID and entering into the chair position now. So that's been very interesting. And then just a little bit more with Texas PTA. I have been serving, and I apologize up front, guys. I've been serving as the Texas PTA Healthy Lifestyles Liaison for a few years now. And Texas PTA is just very adamant about sharing the information that parent leaders and parents need to create that awareness about SHACs and the importance of SHACs. And we do it through a variety of ways with newsletters, webinars, conference sessions. And every year I'm just astonished by how many parents are they don't have any prior knowledge of it. They are truly wanting to make a difference. And so one of the main pillars with PTA is advocacy work. So this kind of goes hand in hand with that. And then just lastly, I was a previous district coordinator for coordinated school health, and I was their co-facilitator for their SHAC as well. So I kind of come at it from a couple of different perspectives, from that district and parent version. And so I think I've definitely seen, both sides of it, and the importance of, recruitment of parents, and the importance of what the district is doing and the information they want to get out to those parents as well. And just a real quick plug, I know it doesn't relate to SHACs, but I also had the privilege working under Dr. Hoelscher for UT School of Public Health a while back as a catch trainer, and with a lot of their coordinated school health initiatives. And so that's kind of been my passion for the past 20 plus years, and just excited to be on this and hopefully raise some awareness about SHACs today.
Thanks, Karen. Our next panelist is Dr. Kimberly Avila Edwards. Dr. Edwards has been associated with the Texas Medical Association for a long time. She's the chair for Committee of Child and Adolescent Health, and she's a co-chair on the Austin ISD SHAC. She also has served on the T-SHAC, so she has a lot of experience with child health as well as SHACs. Dr. Edwards?
Hi, good morning, everyone. I want to thank both Michelle and Deanna for the invitation to be here today. What a true honor. And I want to thank each of our panelists and all of you as viewers for your time and dedication to our communities and to our students. So I am a general pediatrician. I've had an over 20-year career here in the Austin community. I currently serve as the Director of Advocacy and External Affairs for Ascension, Texas, which includes Dell Children's, and as the Associate Chair for Advocacy for the Department of Pediatrics at Dell Med School. As Dr. Hoelscher mentioned, I have held various state and national leadership positions with the American Academy of Pediatrics, as well as the American Medical Association and their state chapters, the Texas Medical Association and the Texas Pediatric Society. But really throughout my career, and I've known so many on this call for a number of years, I think my recognition that to improve children's health, there needs to be engagement outside of the medical field. I've really engaged and worked with various state organizations, including the Department of State Health Services. So when my children were very young, I was mentioning to the other panelists, pre-kindergarten days, I did serve as the assistant presiding officer for the Texas School Health Advisory Committee. And now those children are in high school. And once they both got into high school, I chose to serve on our local School Health Advisory Committee. And I'm currently the co-chair for that AISD SHAC. Again, I want to take a moment to just apologize in advance, as with a lot of the issues that we're dealing with at pediatric hospitals right now and the pandemic. I will have to step off at 12 o'clock, but my apologies and my regrets, but thank you so much for this panel.
Thanks, Dr. Edwards. We're glad you're here. I'd now like to introduce Raquel Roberts. Ms. Roberts is on the Fort Bend ISD SHAC. She's a parent member and she's lead of their advocacy group. And she's been working in public health for many years. I first met her through the School of Public Health. So Raquel.
Thank you, Dr. Hoelscher, and thank you all for joining today. Michelle, thanks for organizing this conversation. As Dr. Hoelscher mentioned, I'm Raquel Roberts. I do serve as the lead for a newly created subcommittee of our Fort Bend ISD SHAC. It's our advocacy committee. Previously, had been coined legislative advocacy, and I think as we got further into it, we realized, this should be a lot bigger than just advocacy directed towards the legislature. So I'm relatively newer to SHAC as a parent member. I joined our SHAC in 2020. And just recently decided upon invitation to lead the advocacy group beginning in 2021. So it's been about a year now. But SHAC is not new to me. As Dr. Hoelscher mentioned, I have been working in public health for some time. I had previously served as the policy and planning director at our local health, one of our local health departments here in the Houston region, Harris County Public Health. And in that capacity, I was the founding director of an initiative called Healthy Living Matters. That's where I first met Michelle and several of you on the call. And so I do look forward to this conversation. As I said, it's been a great opportunity, truthfully, to go from working with SHACs purely in a, I guess, work professional capacity to now being able to do it from a personal standpoint within a district that my son is a part of. So thank you.
Great. Glad to have you here. The next panel member is Karen Schwind, who is the New Braunfels ISD Health Services Coordinator and co-chair of the New Braunfels ISD SHAC. She's also president of the Texas School Nurses Association and member of the Texas TSHAC. So Karen, please provide a little bit more information for us.
Thanks, Deanna, and thank you again for the opportunity to be here. I am very proud to be able to represent nurses, in particular school nurses, on the Texas SHAC, and to be able to share our experience. For the most part, typically the SHAC falls under health services, so it usually does involve the school nurses, and for that reason, I'm really very pleased to be able to be here to share our perspective. As a co-chair of our SHAC, I'm co-chair with a parent. It's always an interesting opportunity to find parents who are willing and able and very interested in what the local SHAC has to offer. And I think the rest of my comments I'll be able to answer during our questions. Thank you for the opportunity.
Excellent. Thanks, Karen. And last but not least, I'd like to introduce Josette Saxon from Texans Care for Children. She is on the TSHAC and she's Director of Mental Health Policy at Texans Care for Children. She also was the former co-chair of the Eanes ISD SHAC. Josette?
Hi, hello, good morning, everybody. It is still morning, correct? Again, as mentioned, I'm Josette Saxon, and I think like Rochelle, I came to SHACs more through wearing a professional hat. My organization, Texans Care for Children, is a policy advocacy organization that really focuses on looking at what state policies can do to help improve the outcomes of kids across various areas of child well-being. And with my focus on mental health, I was very interested in seeing the opportunities that SHACs can have to help really promote the whole child sort of learning approach. I am a huge fan of the whole school, whole community, whole child model, recognizing how important it is for not only children's health and well-being, but of course, as we all know, their academic outcomes as well. And so that is when I became involved with SHACs. As mentioned, I've had the pleasure of serving on the Texas level, the state level SHAC that advises the Department of State Health Services, as well as being one of the co-chairs for my daughter's district, Eanes ISD, and I know we have some members here that are on this call as well from Eanes ISD SHAC. And I think I too will, I think, hold any more comments until some of the questions. But again, thank you for being here.
Great. Thank you all so much. So we'd love to hear your experience and thoughts. So just a few things. If the audience has a question, please drop it into the chat box and we'll try and answer as many of those as we can. We will send out the recording to you afterwards, and we'll also have a survey after this. So just wanted to alert you to that. And now on to the discussion. So the first question is, how has the pandemic changed focus and work for SHACs? And Dr. Edwards, I'd like to maybe start with you.
Sure, thank you for that question. I think I'm uniquely qualified to answer the question, considering that I was asked and inspired to serve on our Austin Independent School District SHAC during the pandemic. As a parent of 2 high school students and as a physician, it was so important for me to be involved, to share current information and guidelines, and to support our district in their efforts to keep our children safe and, very importantly, in school. You know, those were my goals in the short term. And I think in intermediate and long term, really, my goals have been to bring a greater breadth of possible influences. There's so many issues, whether it's school nutrition, children in nature, human sexuality and responsibility, to name a few that we're working on. It has been such a great opportunity to increase engagement throughout our district during the pandemic as we transitioned over to virtual meetings. It's been wonderful to engage some of my colleagues who could not previously make it to the meetings, and just seeing the enthusiasm has been very inspiring.
Thank you. Karen Schwind, would you like to answer that question?
Sure. We found that during the 2021 and 21, I'm going to get them mixed up. Not this current school year. This current school year, we're meeting in person. But the prior two school years, when we were meeting virtually, we did find that parents participated via Zoom. We actually had some of our highest enrollment with parents during that time. Now, this year that we're meeting in person, it does seem that it's a little more difficult for parents to attend meetings. So we may revisit that and look to going back to our Zoom.
Great comment about that. Josette, did you have something to add to that?
Yeah, I think I want to echo what other folks have said too. I think the ability to move to Zoom once the pandemic started, I think really has helped in a lot of ways. Again, it's just easier for people to attend, and not only parents, but also other district representatives. The way our meetings were scheduled, it was right at the end of the high school day. And so it allowed some SHAC members who were part of the district who were at different schools to not have to fight traffic to get there. It allowed parents who, let's say, if they had their littles in elementary school, they didn't have to worry about finding somebody to watch their kids. And so I think it was one where really the ability to meet via Zoom is something that I think our SHAC will continue to do even after it's safe to meet in person again, in some way, shape, or form.
Thank you. And Karen Burnell, maybe a last comment on this.
Yes, thank you. I know we were kind of discussing this a little before, and I think, as we do have a variety of districts on this call, our district was a little different because we have been trying to grow our Richardson SHAC. And when the pandemic hit and we switched to virtual, we really didn't have as many parents as we would have liked. And sadly, progressively through last year, not this current school year, participation just dwindled. And since reinstating and starting to meet in person, which we have talked about doing that hybrid of maybe in person and Zoom the next. And I think that's a nice blend, some of those positive takeaways we're getting from the pandemic of, the need sometimes to meet in person, but the flexibility that virtual provides. And we've actually seen an increase in our parents this year. So we're hoping to continue to see that momentum.
So it looks like work and school, that this might take a more hybrid approach in the future. So I like that idea of more flexibility. So the second question we have is, what role do you feel SHACs play in student health, and how important is that role? So I'd like to start again with Dr. Edwards.
Sure, thank you. So I think it is well recognized that research supports the strong connection between health and school performance, whether it's attendance or behavior, academic or overall performance. And I know that we are becoming much more aware that the environments where we are born and live and grow and play, worship, all of these affect and have a wide range of effects on our health and functioning and quality of life outcomes and risks. So I think school health advisory committees are really, really critical to bring together individuals representing all our local communities that have knowledge of these social drivers of health to uniquely help our school communities support health and learning. And I feel that because of this, SHACs are just really vital to our local communities and our local children to help bring about that dual responsibility of their health and their school performance.
Thank you. Raquel, can you maybe add to that?
Sure. So, I think SHACs are really important if you want to have just a structure in place for that ongoing communication between community. So like nonprofits that are parts of SHACs, are part of SHACs, and then parents. Direct ties to the school board, right? And so, there's obviously the opportunity to convey concerns during school board meetings, but just having that structure in place for that routine, ongoing communication, I think is really important. That is really key for establishing relationship, right? Like any elected official, they don't necessarily want to always hear from someone unhappy about something, like with the mic, right? Sort of blasting them, but really just having that opportunity, I think, is really critical. And by extension, when those relationships are developed, the school board feels like they do have a trusted partner, right? So the subject matter expertise that is available through the SHACs. In the case of Fort Bend ISD, I have observed that there is, direct reaching out to the SHACs outside of, the typical meetings for that subject matter expertise, and integrating some of that expertise in some of the activities of the district. So that, I think, in a nutshell, captures it. It's really about relationship building and having that structure in place over time.
Yes, I totally agree. And another thing I think that's important in terms of what I like to look at with SHACs is there's a measure of accountability there for health that's at the school district. So it's kind of hard to get at it other ways. So SHAC is very important in that point as well. Oh, Karen.
In terms of coordinated school health, I do feel like it's an excellent place for us to all come together to be sure that we're providing that consistent message across the district, as well as legislation. Every legislation session, there is something related to health, and it's often very helpful to have parents and district members both understand the details and the need for following that legislation, regardless of what area of health it addresses. And that's also important at the state level. The TSHAC is also very essential in being able to provide that information in a timely manner so that the local SHACs are able to continue with that coordinated school health and implement all the changes that are needed.
Yeah, that's an excellent point. Our next question for the panel is, I'm going to ask about how important is participation from different groups on the panel. So I'd like to start with Dr. Edwards and asking about participation from the medical community on SHACs.
So I'm going to reiterate kind of a theme that I'm hearing amongst us all, which is really that this is about relationships, collaboration, and teamwork. And, as members of the medical community, I would say we're uniquely positioned to help, recommending policies or procedures or strategies to promote health for our students, since our profession is really defined by work in this space. So fully disclosing my personal bias, I would say their participation is extremely important. As some concrete examples during the pandemic, I and my colleagues have been able to share real-time developments about guidelines around SARS-CoV-2 for mitigation strategies such as mask wearing, and sharing real-time updates that were coming out. I can remember during one SHAC meeting about vaccinations. And And I've been able to speak about the pediatric mental health crisis. Thank you, Josette, for talking about that, which we as medical professionals are encountering on a daily basis, while at the same time sharing successful programs that we have in our communities, such as the one funded by this Texas State Legislature in 2019, and again this past year through the Mental Health Consortium, including the Texas Psychiatric Access Network and the Texas Health Child through access through telemedicine or TChat, which is particularly available for our school districts, and just bridging those connections in real time has been extremely important. So I think on the one hand, it's a way for healthcare professionals and the medical community to be involved and promote health outside of the walls of our clinic. But I also need to share that the medical community is but one influence or just part of the health of a child. So critical to the mission of the SHACs is the involvement of other community members, which I know you're going to be talking about.
Yeah, thanks so much for bringing up TChat. There really needs to be better participation in this program across the state. So however we can help in getting that implemented, that might be something we bring up later. But I know you're going to have to sign off soon. So thanks, Dr. Edwards. But kind of continuing this line of questions is, what about other school district leaders and what role should they play in the SHACs? So I'd like to start with Josette.
Yeah, what I think is, part of the beauty of SHACs is the opportunity, as has been mentioned, to build those relationships, those ongoing relationships where you're bringing family members, community members, and district leaders from various areas within the district to come together and work in partnership. And as I also mentioned earlier, one of the benefits of having remote meetings was the ability of, let's say, a phys ed teacher from one school who might not have been able to make it to our campus meeting to attend. So, having, the different representatives from different departments that really touch, the whole school, whole community, whole child model. So we regularly within our SHAC, would have updates to stay in communication and to be apprised of what is going on, not only in some of what we think of, let's say from the nurses or the counselors, but we would also we would have participation from the nutrition department. We would have participation from, let's say, facilities and transportation. So that we're really looking across the board at, what are these issues that are affecting our students' health, safety, and well-being, and staff. I will also mention that in light of the pandemic and knowing that there's the social emotional effects that our kids are having, everybody I think here would recognize this too. It's the teachers, the staff, the administrators, the bus drivers. And so we spent one of our meetings hearing from the Human Resources Department to hear about what things they were doing as a district to address staff wellness. And so again, I just reiterating that the more we can make SHACs not only engage, key people in the community and families, but then also members of the district. One thing too, I want to mention here that I don't know if it's addressed anywhere else, but within our SHAC, we also prioritize making sure that we have student representation. And so again, realizing that if we're bringing all these expertise and perspective together, we need to have students in the room. And just the ability to have them and ask them, okay, we might have just heard from what some parents are saying or a teacher is saying, what is this looking like for you and your peers? And that is some of the, I think, the most rich information that we will oftentimes get. And it's very rewarding to then see those comments being taken to the district and really doing some immediate problem solving and fine tuning. And so that's another group that, I think is not required to be on a SHAC, but really if we want to know, to know what's going on in a school, bring in the students.
Yeah, I think that's a really great point. I know my husband served on a SHAC, and one of the issues was sleep actually with kids that they kind of brought up that was on their radar, but wasn't as high as the students mentioned. I also really think that you've hit the nail on the head in terms of taking care of staff wellness. Teachers have had a very difficult time, as have administrators and everyone associated with schools. So really being kind to them and looking at how we can improve their health as well. So Karen, you mentioned about being Karen Burnell, both inside and outside the school district. So do you want to talk about getting the school district involved in SHACs?
You know, yeah, from the two different perspectives, I'll kind of wear the hats of, and especially in recruitment of parents and community members. And maybe I'm jumping a little bit into the recruitment phase, but I feel that there's such an awareness that, you know, was an evolution when I was a district coordinator, to where it was, you know, maybe sending a memo out to the principals, letting them know, because we had such high principal turnover, sending out something, coordinating with your PTA council, which a lot of sometimes the districts aren't aware that there's a council within their area, that PTA council then can share and disseminate information out to those local PTAs, where all PTAs may not have a local healthy lifestyles chair. They could still recruit a parent with vested interest. It doesn't have to be that particular position being recruited to serve on the SHAC, but I think that's just, it's critical in creating those recruitment pieces to, sorry guys. Sorry, hold on. I promise you it's just a cold I'm getting over too. But yeah, so back to just the recruitment. I've lost my train of thought a little bit, but just sort of that multifaceted approach. I think, you know, I just want to echo what the others have said, from the employee wellness, having that representative on, you know, your district, as well as, you know, your health services coordinator, PE coordinator, and just ways to recruit those parents.
So Raquel, can you maybe talk about recruiting community members onto the SHAC?
Yeah, so, you know, there's always that challenge. I guess when you are referring to community members, are you talking about organizations or like parents?
I think you could address both. Yeah.
Okay. Yeah, so organizations, I think, find a way to reach out and identify opportunities to participate in SHACs. I think the greater challenge is probably the regular engagement of parents. And by that, you know, I'm really just referring to the competing demands that parents have, right? And the time of day that oftentimes the meetings are occurring. And so one way, though, that I think, and it will probably help to provide a little background on how our SHAC is organized. But one way I think that parents could be better reached is through the children. And so going back to just how our SHAC is organized, Josette mentioned the importance of getting that engagement of the students themselves. And so NBISD has established some student wellness coalitions across various high schools throughout the district. And that is really an extension of our SHAC. And so this is an opportunity for students to prioritize what really matters to them and to have some influence on the activities of SHAC. And, you know, with that sort of structure in place, it really is an opportunity that, you know, through those participants, that parents can better be reached and engaged. And so that in and of itself, I think, creates an opportunity. We also have campus wellness committees throughout the district. And so there's a parent liaison role for the SHAC that really helps get what's happening at the SHAC level into on campus. And so through that, I think there's just more opportunity to be in tune or to better reach parents and give them the opportunity to participate and at least hear what's happening at the SHAC level, but also the resources that are available through SHAC.
Yes, I think that's a really great idea to get parents involved at all levels of it. There's many different ways to get them involved. A couple from the chat, there's a couple of other ISDs that have mentioned having student representatives, Eanes ISD and Canyon ISD. So with that, I'd like to talk to Karen Schwind about the role of nurses in SHACs and how important that is.
Well, I think it's one of the important pieces, especially when we look at coordinated school health. We want to keep our children healthy so they can be in attendance and ready to learn. And those school districts that have school nurses are very honored to be able to have their school nurse represented on the SHAC. As you may or may not know, school nurses are not required in the state of Texas. And so there are many districts that do not have school nurses. And so that role is not present. And we know that the presence of a school nurse at school will increase your attendance by keeping students in their seats and not sending them home. So other than for COVID right now, oh my goodness, it's a whole different world out there. Right now, but overall, I think that the school nurse is a very important role in the SHAC in terms of school health, as well as all areas of that coordinated model. And with parents too, many of the parents who come or bring issues to the SHAC are often those school health related issues that school nurses can help define and help identify ways to overcome if it's a problem, or ways to enhance if it is a positive. I often over the years have found that whatever the hot topic is, it will become the topic of the SHAC. So if we're, for instance, this year we're reviewing sexual education curriculum. So we'll see an increase in the parents that have a mission to have an input on that curriculum, or if there's a change in nutrition and what we're serving in the cafeteria, those that have that interest. And so I can see, as Rocaille mentioned, I can see how those subcommittees can then form as to what curriculum we're adopting, what practices we're maintaining, and how parents can be involved with that, and as well as the school nurse implementing the health side of it.
Yeah, that's about nutrition because the child nutrition reauthorization has still not happened. We're kind of behind the ball on that. So when that happens, I mean, we're still under Healthy Hunger Free Kids Act of 2010. So we're expecting that should change sometime. So we'll see what happens with that. So I think keeping abreast of all these changes and knowing when they're coming down the pike and keeping that at the forefront of a SHAC discussion is very important. So Karen Burnell, you mentioned when you did your introduction that a lot of parents don't know about the SHAC, that you really like to get information out about the SHAC. So how can we better inform parents about SHACs and their importance and what they do, not only to serve on it, but also for them to pay attention to SHAC minutes, what's going on there. I feel like that's really an area that we might be talking about a lot, but I don't know that parents are talking about a lot.
I absolutely agree with you. It's not on the parents' forefront of their discussion for the most part if they don't have that sort of vested interest. And I was just paying attention a little bit to the chat as and somebody had made mention that that when they got involved in the SHAC, that it was from a key involvement that from their SHAC director asking principals to solicit out parent volunteers, and that's how they got involved. And I think, again, it comes back to that sort of multifaceted approach, right? Part of the building and scaffolding we had done when I was a district coordinator was not just sending out memos to the principals, and we started recruiting earlier, well before, like April of the year prior, not waiting until right before the school year started. And that was different from what had been done before. We created an online parent orientation so that they could watch that prior to and kind of hit the ground running, created other resources, FAQs and such, based on other samples that are out there, but really to just get that information as succinct as possible out to the parents, keeping it simple, but that it won't scare them away from serving, because a lot of them have those time commitments. So I think it's keeping the terms and, you know, the key issues as simple as possible, and coming from the district perspective of recruiting, as well as if you are on a PTA or a PTO, using that as another vehicle to share when you do board meetings, you know, share what was going on at that SHAC meeting. So then that information can be disseminated out through that local elementary as well. So, and then also working with a family engagement coordinator within the district. So again, if you don't have a high parent organization involvement, and you could still utilize perhaps parent liaisons to coordinate with that school. So really kind of hitting it from all different angles. And again, I know Texas PTA will continue to share that information just ongoing as parents cycle in through these new PTA roles, and not just sharing it with a healthy lifestyle chair. We've done a lot just to reach out to presidents and vice presidents of programs and such, because again, that may not be a position, a healthy lifestyles chair on a PTA. So you have to tap into, you know, that broader reach of getting that information out there.
Great, thank you. So we have one last question for the panel, and we'd also like to open it up for questions for y'all. But first, if we could have the panel answer what kind of state level support would be helpful to SHACs. And that could be everything from financial support to support from different organizations to what do SHACs need from state groups or the state itself to be fully functional and helpful and achieve their aims. So Josette, I'm going to start with you.
Yeah, I think one of the things that I see a real need for is a clearer communication pathway from, let's say, the Department of State Health Services to the SHACs. Right now, the state relies on the Friday Beat, which is an email listserv that many of you may be aware of or not. But it is really the mechanism that the school health department within the Department of State Health Services uses to disseminate information to the SHACs. And it's more of like an opt-in. You have to go and sign up, and it's not just even specific to SHACs. And so I think right now what's really missing, one of the things that's missing in the state is, I think, better communication pathways between local SHACs and the state level SHAC. And recognizing that back and forth pathway, the state can learn more about what local SHACs are experiencing in quicker time other than through surveys, as well as the state can provide helpful information directly to SHACs maybe more easily. And so that is, I think, one thing that I would like to see happen in the future.
I think with the virtual world now, there's probably more opportunities than there have been in the past to do that too. So great suggestion. Karen Schwind.
So this is a loaded question for me. As I serve on the TSHAC representing school nurses, I also see the need for a couple things. One of those being, I think I mentioned it in my introduction, legislation changes every 2 years, as we know, and much of the legislation that's required for schools to implement, there's guidance that's prepared, whether that be from TEA, from TASB. Many health-related topics come through DSHS, and it always seems like the information is delayed in getting to us. So the school districts are having to make their decisions based on the legislation without the support as it can be prepared in time, and without the support of those agencies. So I think that the TSHAC has an instrumental role in that. I think that there's a lot of information that the SHAC currently has that we just need to be able to share how to get to it. For instance, somebody mentioned, Deanna, I think you mentioned sleep. I just served on a committee to prepare and update the documents about schools starting later for our secondary students and the importance of sleep for our teenagers, well, for all children, but particularly those teen years. So I think that there's information that's already out there that we just need to make sure local SHACs and parents have access to. And lastly, a great concern that I have currently from a school health standpoint is that the school health coordinator position, the school nurse coordinator position is open right now at the Department of State Health Services. I think it's still open and it's been unfilled since August. And as school nurses, we rely on the Department of State Health Services to provide us with information that we can disseminate to our districts and to our school nurses. And we really see that position as very much of a need to be filled and filled very soon so that we can have that reference. It's always been an excellent reference for us, not only for school nurses, but also for the school health advisory councils.
Yes, I totally agree with that. And I don't know if someone has a link to that job description or if they can, we really value that position as well. So however we can get that filled, I think that would be important for SHACs. I do want to mention that our center does have a legislative bill tracker that during the legislative session that keeps track of bills, and a lot of those have to do with school health. So you can kind of follow the bill on our bill tracker on our website. I think Tiffany Menendez is on the call. She can maybe put that in the chat box, but it's a good resource for y'all. And if there's a topic that you would like to have tracked, if you could let us know, we can maybe consider adding it next time we go. Raquel, could you go ahead and comment on this?
Sure. And yes, we've actually used that bill tracker, and it's been very, very helpful in helping us stay current on what's happening as the legislature is unfolding its activities. And then, beyond that, just knowing what actually happened, right? What passed, what didn't pass. So I'm going to just put on the hat of lead for the advocacy committee in particular in response to this question, because there is really an interest among the members of raising awareness among elected leaders of what SHAC is, the role of SHAC, why SHAC is important. So the conversations that we're having today, legislators need to hear about. And so one of our primary goals really is to better engage with those elected leaders who represent our region. So definitely those who represent Fort Bend ISD, but just the greater Houston region in general. But, there's, SHACs across the state of Texas, and wouldn't it be lovely if we all could have similar messaging and efforts to reach those elected leaders, legislators in particular, who are making decisions about SHAC and the role of student wellness in our school districts. And so I think to whatever extent this network or others can help SHACs get organized and communicating that one message, but also encouraging SHAC members to get to know who their elected leaders are. I think that would be a great step in the right direction. TASB, as many of you know, have a very critical role in supporting school boards. And so as new school board members come on, there's trainings to get them up to speed with what it really takes to be a school board leader. Wouldn't it be nice if at that point they would have a better sense of the roles of SHACs, right? And really be champions for what we all are trying to accomplish to benefit student wellness. So those are my my two asks, if you will, of just thinking about what can happen at that state level to elevate the work that's happening locally.
Thank you. And Michelle put an item in the chat box about an advocacy learning session coming up. So that might be something following up on Raquel's comments that y'all might be interested in. I do agree. There is a comment in the chat box too about volunteers staying on top of legislation. Even those of us that track it, that can be difficult at times. Karen Burnell, would you like to kind of give your perspective on this?
And I'm trying to figure out what to say going last, right? I think everyone has kind of hit the nail on the head. I just want to echo what the other panelists have mentioned, because I think they're spot on. And for those that may not be aware, the SHAC is volunteer, just as serving on a local SHAC. So, developing these resources can be a daunting task, but, I think the great work that's being done out there with launching the SHAC network, with Action for Healthy Kids, and the partnership with, all of these other wonderful organizations. And in the SHAC, I truly think what we're starting to see that momentum needed to create those resources. And I'm going to kind of, again, go from the two hats of a district. When I was in the district position, if we were looking at updating wellness policies and such, you go start researching other districts, maybe larger districts to match what your size is. Smaller districts is, it might be slightly different. And then from the parent perspective, again, recently going and looking for some, bylaw samples. So I think the more varied resources, samples that we can provide in a succinct place that either district leaders can go to and or those parent chairs and volunteers, that if we can have, here's a sample agenda, but here's ABC, and here's, sample bylaws, but here's ABC. So that way we provide a true, again, I keep coming back to that varied approach to where you're going to see some representation from a smaller district to a larger district, and some of the great ideas, because I think a lot of times we spend time reinventing the wheel when there's some great resources out there already with other districts. It's just finding that place to house them all. So I think that I just want to end on a positive note that I think there's a lot of great things out there. And I know Action for Healthy Kids we've used their establishing priorities check sheet. So, there are a lot of great resources out there, and I think we're heading in the right direction. So just kudos to everybody that's been a part of that and has been a part of this. Thank you.
Yes, and just to build on that, I think joining the SHAC network and keeping abreast of what's happening with Action for Healthy Kids is one way to kind of keep that moving. So we are getting close to time here. Does anybody have any specific questions from the audience for our panel? We have time for one, maybe two questions. Well, I always have a question. I think my question is, I noticed that Karen Schwind mentioned that there's always, I see Olga has a question. Olga, why don't we go to your question if you want to, Olga Rosenberger?
Yes. Hi, Deanna. I have a question regarding students serving on the SHAC. I know some of the topics are, different topics that may not be appropriate possibly for all age students. So for those districts that do include students, do you all have certain ages of students that serve on the SHAC?
Yeah, we have high school students, usually juniors or seniors. And I think we work with, some of the district members or the leaders to identify people that they think would be good. But yes, we definitely reserve it for the high school, the older senior or the older students.
It's really nice if they can drive to the meetings, so they don't have to be delivered to the meetings. And then the topics usually are appropriate for that age group as well.
Yeah, I know that at the high school level too, a lot of high schools have HOSA organizations, and a lot of times those students are very interested in serving on this because they're looking for a career in the health sciences somewhere. So that might be a good partnership at some of the districts.
I thank you so much. I know we're looking at, I'm from Irving ISD, and we don't have students yet, but looking at that and, just how we would go about doing it. So it's very helpful to know other districts are including them already. I did see something on the chat regarding, partnering with different departments. I know I'm over the food services department, and I think are an integral part of that, of our SHAC. We do use that opportunity to do, when we could meet in person, to do taste testings for different menu items. So that we can get, just feedback from parents so that parents know what their students are receiving. And so that has been really helpful. Zoom, unfortunately, Zoom has not allowed us to do that, but I do agree that I think we see maybe more people when it's Zoom because it's just a lot more convenient. But I really appreciate, and I loved sitting here and listening to all the great ideas and things that everybody is doing. I know the link there for a survey was not working, but I sure would like to get on this mailing list.
I think Michelle reposted the link. So Michelle, did you want to say something about that?
Yeah, there was 2 extra letters at the end of the link and it wasn't working, but the one that's in there now is working. So, and we will send that link out again along with a link to the recording. Probably either later today or tomorrow. Interesting, we still have people joining us. And it's 2 minutes till closing. Okay, but anyway, yes, we will.
So any kind of, we have time for a real quick last minute comment. I noticed there was a chat that said that the bills that impacted SHACs happened very late in the legislative session, and that's true. I think this past legislative session, there were just a lot of issues in terms of the ice storm and everything. So really, hopefully this upcoming session next year around this time, we'll have a little bit more time to kind of consider some of those.
One of the things we're going to do is do an advocacy session probably in March. We're also building a microsite where we can put information. We have some resources that are really close to being finished. We're waiting for the website link to put on there to help SHACs talk to legislators, because the biggest issue we faced was legislators not even know what a SHAC was. And so we have got to get in there now and meet them and say, this is something that's mandated. We think it's important. And, we want you to know what it is now so that when some of these bills come up, you understand what it is we do, because they don't even know. And then somebody comes in and says, oh my gosh, SHACs are doing these terrible things and we've got to stop them. And again, it's what do you do? Fake media. What can I say? So we need our SHACs to talk to their legislators, just sending emails or get to know doesn't even have to be the legislator, their staff will get the word to them and understand. We have worked with staff to pass bills for SHACs for years. But again, there's a lot of turnover and we kind of forget that there's new people and they don't know anything unless they participated somehow. So it's going to be really important, and we hope that you will join the SHAC network. If you fill out the evaluation, there's an opportunity to say, yes, I want to participate, and we'll add you. So hopefully we can do that and keep going. Is there a hand up? No.
That was previously
Yeah.
with Olga. Yeah. So I think we're good. We're right at time. So thank you so much for attending this afternoon. As Michelle mentioned, there will be a recording. So you'll be able to get to that. And don't forget the Action for Healthy Kids Summit on February 15th and 16th. Michelle, any last words?
Yeah, Hayden put, and we'll add this to our email as well. Hayden with the Department of Sales Services did add in the link to the Texas School Health SHAC webpage, where they're in the TSHAC webpage, so you can get some additional information, which is helpful there. So thanks for adding that in. And we hope you got some good information today.
Thanks to you all for attending. You really should be proud of the work you do to keep our younger Texans healthy. It's very important. We're building the future of Texas, and your work with SHACs certainly helps to do that. So thanks so much. Have a great rest of today. Bye, everyone.
Thank you.